If you've got a pain in your butt known as piriformis syndrome or SI joint dysfunction, then in this video, you're gonna learn the real root causes for this, the anatomy, so you understand what's going on, and 5 exercises to get you lasting relief. Coach E from Precision Movement here, and today I am gonna help you with piriformis syndrome and SI joint dysfunction that causes pain. How we're gonna do that is we're gonna talk about the symptoms, make sure we're on the same page here. I'm going to take you through the anatomy so that you understand and can visualize everything that's going on and what everything is called. So you are armed with the knowledge you need to know to address this for good. Then we're going to go through some research where I describe what the real root causes are. I'm going to share something shocking I found about surgery. I didn't know this before. And then I'm going to take you through 5 unique exercises that will get you on the path to lasting relief. So to start, symptoms. What are you experiencing? Well, pain in the butt. To make sure we're on the same page here, I'm going to draw a butt, which may resemble yours, it may not. Right there, that is the middle. What are we talking about? So piriformis syndrome typically is pain that is in this area. It's kind of achy pain on the outside of your butt cheek, and it's a line going across horizontally like that. So that's piriformis syndrome. You might have pain there. You might have pain in a more targeted area like that, where you're kind of pushed just below your lower back at the upper part of your glute. That's the SI joint. Or you might have radiating pain going down the back of your leg. Could go as far down as your foot. That's numbness, tingling, those types of symptoms. That is a symptom of sciatica, where the sciatic nerve is impinged, and that could be related to the piriformis, or it could be related to some other structures that we're going to discuss. So if you have pain or any of these symptoms right here, then you are in the right place. Now I want to show you the anatomy so that you understand and can picture everything that's going on. This is you. Don't worry, your right arm isn't missing. I've just hidden it for the purposes of this demonstration. Let's start by talking about the SI joint, what that is, because you might not know what it is. This bone is called the sacrum. This bone is called the ilium I. So sacrum S, ilium I. The joint, the SI joint, is right here. The joint between the sacrum and the ilium. You can see that on the front, and you can see that on the back. This is the joint here. Now, this joint doesn't move a lot, but it should move a little bit. What's most important when it comes to proper function of this joint is keeping it stable and the muscles around it allowing it to move when it needs to, and keeping it stable and preventing it from moving when it shouldn't be moving. And what are those muscles? Let's start with the main reason why you're here, possibly. The piriformis, this muscle here. You can see here, it originates on the sacrum, passes through and behind the ilium, and inserts onto the head of the femur. This is the femur, the upper thigh bone there. Give you the big picture view. Okay, so that's the femur. So this piriformis muscle, that's important. What else is important? Well, let's look at the front. So is this muscle right here. You can see it passes from the lumbar vertebrae right in front of the SI joint, super close, and then inserts into the head of the femur again. And this muscle is known as the hip flexor muscle, bringing the knee up to the chest, like you're doing a high knee run or maybe the can. But it's also important because of its anatomy, where it starts for stabilization and even some extension of the lumbar spine. Next up, what do we have here? Let's go to the back. We have, where are you? I'm going to have to search and find you. You can't hide from me. The gluteus maximus, right there. Gluteus maximus. Now, it doesn't insert or originate straight on the sacrum, but it inserts into the thoracolumbar fascia. It's a thick band of fascia that goes right here in a diamond shape, and that fascia inserts onto the sacrum. So, in effect, the gluteus maximus connects to the sacrum. And then it crosses right behind the SI joint. You can see it's kind of covering the whole SI joint back there, and then again inserts into the head of the femur. Finally, the last group of muscles I'm going to show you here that are really important are the pelvic floor muscles. right on the bottom of the sacrum here. You can see it from the back, and then connecting down to the pelvis, the pelvic bones down at the bottom here. So these four muscles or groups of muscles are the ones that are most important when it comes to stability and function of the SI joint. And now that you understand the anatomy and you have the visual in your mind, you'll really understand why I've chosen the exercises that I've chosen to help you with piriformis syndrome or SI joint pain. I hope that little anatomy lesson was helpful for you so that you can visualize exactly what's going on, and you'll really understand why the exercises that I'm going to show you are effective. Before we get to the exercises, let's talk about the root causes. And in this section, I want to share some research that I found that really shows you what's going on. The title of this study is Physical Therapeutic Options for Residual Sacrotuberous Ligament Pain After Treatment of Sacroiliac Joint Dysfunction. And in the study, the researchers looked at 303 patients with SI joint dysfunction. 57 patients had persistent lower buttock pain after injections. That's lidocaine, which is a local anesthetic. It numbs the area. Of these, 19 experienced relief after further sacrotuberous ligament injection and or manual therapy. Hamstrings muscle relaxation relieved pain in 8 of these patients, while gluteus muscle contraction relieved pain in 6 patients. So what this study shows is that even anesthetic in and around the area wasn't enough to get rid of all the pain, and some people required hamstring relaxation and glute maximus contraction or activation. And this is going to be important for something I'm going to talk about in a second. But before we get to that, one more study for you. This study is titled Assessment of Piriformis Muscle Thickening and Sciatica, Focused Ultrasonographic Evidence in Patients with Lumbar Disc Herniation. In the study, the researchers looked at 107 participants who were diagnosed with lumbar disc herniation. And what the researchers found was that significant thickening of the piriformis muscle on the affected side in patients with lumbar disc herniation was likely due to mechanical and inflammatory adaptations. Now, what this study showed was that piriformis syndrome was secondary to lumbar disc herniation. So on the side, let's say I have a lumbar disc herniation that's more on the right side here, my piriformis muscle was thickened, it's stronger, it's hypertrophied. And the reason why is because on this side, when the muscle thickens up and other muscles will contract and thicken up and get stronger, those muscles are working to try to prevent further movement. It's trying to prevent me from doing this movement, side bending to the left, which would exacerbate the herniation on the right side. So this is known as protective guarding of the muscles. And this is why if you only focus on the muscle and just get massage or you stretch the piriformis out, you're not going to get to the root cause and it's just going to keep coming back. So what's this all about here? Got these blanks, fill in the blanks time. Root causes. All the things that I talked about already from the studies, one of the main root causes of those things is sitting. What does sitting do? Well, you sit on your butt all day, it decreases your glute strength, and it can do something known as inhibit or shut off the glutes and cause them not to work so much. Now, if you have glutes that don't work well, your body needs to compensate for that dysfunction and that deficiency. So what happens, you can increase your hamstring activity because the hamstrings also contribute to hip extension. That's pushing your leg back behind your body to propel you forwards. So if the glute's not doing that, the hamstrings try to kick in, and that's where they would get taut and overworked. They feel tight all the time, like you have to stretch them. And that's both related to the first study that I talked about. Now, the third thing I've got down here is what position do most people sit in? Well, it's a slouchy, rounded backed position with your tail tucked under in a posterior pelvic tilt. And what can that lead to? Well, lumbar disc herniation. So sitting can lead to all of those things that we identified in the 2 studies in the root causes section. So what do we do about it? Well, should we do surgery? Should we do other kind of conventional medical treatments like numb the area or stick Botox in the area to paralyze the muscle? Well, if these are the root causes, then no, that's not going to help. So there are some different surgical options that involve cutting the tendon from the bone or releasing the nerve, the sciatic nerve, from the adhesions around the muscle. But the one that I found most shocking was that if you Google this, you can find it on your own, is that some doctors suggest removing the piriformis muscle completely to alleviate the symptoms of piriformis syndrome. And after seeing the muscle on the biodigital app and seeing it's a fairly significant muscle in terms of size, and it crosses the SI joint and it impacts the hip joint, Do you think that's a good idea for your long-term movement health and mobility and function? Well, I don't. And because I don't, I've come up with other ways to fully and properly address the root causes that I talked about. And that's what we're going to get to right now, the 5 exercises to help you with your piriformis syndrome or SI joint dysfunction. The first exercise is ASMR for the posterior hip, and we're going to focus on the piriformis muscle itself. So in terms of ball placement, you're going to be around there. We're going to hit 3 different spots along that horizontal band across your upper butt, let's say. The benefits of this are to relax the muscle. It could be contracted because of protective guarding, because the joint is unstable and the piriformis has to contract to lock everything down. Like I talked about earlier with the study, if you've got a herniated disc, the piriformis can compensate by guarding, or if other muscles aren't working well around the pelvis, then the piriformis can contract more than it should. So we're going to release it. So first I'm going to place the ball at the start of that lateral band near the midline of my body, get this other leg out of the way, and with my foot flat, I'm going to drop down towards the floor, push it towards the floor a little bit, and then this is the most important part. I'm going to bring my knee across the midline as far as I can and keep the pressure, so I'm leaning over towards the other way that I'm bringing my knee to keep the pressure on the piriformis. And then I repeat that for 3 repetitions. So across the midline, because when I bring the piriformis or my leg across the midline of the body, that fully lengthens the piriformis and can release and relax that muscle the best. After 3 reps there, I'm going to straighten the leg out and then bend it. Straighten it and bend it. And this is stretching and lengthening more the glute for 3 reps. And then I'm going to a slightly different area. So now the ball is going to be more on the outside of my body, and same thing. Drop it to the outside, and you're going to feel the pressure there, especially as I bring my knee to the ground. And then the pressure is going to release a bit, so I've got to kind of adjust my body to keep the pressure on the ball as I bring my knee across the midline. I want that pressure there. That's going to relax it both mechanically or structurally and neurologically. So 3 reps there, and then 3 reps there, straightening and bending. And then last, I'm going to move it right to the outside, and I've got to rotate over a little bit and make sure I'm keeping the pressure on the ball to release the muscle as best as I can. So 3 repetitions of each move in 3 different areas. Do it on both sides to keep both hips and pelvises working well. And that is ASMR for your posterior hip. The second exercise I'm going to take you through is called the Piriformis ERE, and ERE stands for end range expansion, and it's a specific protocol that I use to simultaneously build length in a muscle while building strength at the same time to keep a joint stable, because you don't want length in a muscle without strength, because then you have an unstable joint. We are targeting the piriformis for this, and what you need to do is you need to sit on something stable, and you're going to cross your leg over so that the ankle is resting on the opposite thigh. And I want to be at a point where I can do this under my own muscular contraction. I'm not doing it by lifting my leg up and then placing it on. So if I have to lower my leg down to do this and do it in this area to make it easier, then that's fine. But here, I'm going to start from this position. Now, in this position, the piriformis muscle is an internal rotator. It rotates my hip this way. So if this is this bone, the femur, it rotates it inwards, or like I'm sweeping my ankle down and out to the side that way. The first contraction I want to do then is external rotation, because that's going to lengthen the muscle. And to do that, I'm going to think of rotating my thigh this way and rotating my ankle off my leg right here. Not just lifting it straight up, but rotating it up. So here, I'm thinking of rotation, and that's going to help to stretch out or lengthen that piriformis muscle and relax it actively, but it's also going to strengthen the opposite muscles to the piriformis. So I do that, hold that for 10 seconds, and then I place my leg on the thigh, and I'm going to internally rotate. Not just press down, but internally rotate. So I think of that rotation move. So the leg is going to sweep out in that direction, and I contract and hold there for 10 seconds. I'm keeping the knee where it is in space. I'm not lifting the knee up to do this movement. And then after 10 seconds there, I'm going to do one more external rotation. So rotating the ankle off of my opposite thigh there. Hold that for 10 seconds. And then what I like to do is to bring it down to the ground slowly, so I work through that full range of motion. And even if I have problems only on one side, I'm going to do the other side as well and alternate between the two to complete all reps, because I want to maintain good strength balance between all of the muscles around my body. So those 3 contractions, the lifting up, the pressing in, and then the lifting up, that's 1 repetition. Exercise number 3 is going to get those glutes fired up and strong and activated. And it's also going to help to get the other deep muscles of the hip and the pelvis to work as well, because we don't know if those are the only root causes that I talked about earlier. So we want to make sure that we're covering all our bases. This exercise is called the marching hip bridge. So it's like a typical hip bridge exercise. You set up the same way, and I always like to get the shoulders back, chest out, and align myself with good posture. The more we can practice good posture, the better. From here, the first thing I'm going to do is contract my pelvic floor. So I do that by pretending that I'm peeing and then stopping it midstream and pulling everything up and in towards my pelvis there. So I get those pelvic floor muscles on, then I get the glutes on. So squeeze the glutes, squeeze the butt muscles. And from there, I keep all that stuff on, and I lift my hips up until I'm in the neutral hip position. Then I'm going to just slowly march, take 2 steps with each leg. So without letting my hips drop or rotate, I'm just going to lift one up, and then I'm going to place it down slowly. Soft landing, and then I'm going to do the other one. And then I'm going to alternate for 2 on each side, breathing naturally throughout, keeping my hips up. And then with the glutes on, lower all the way to the ground, and then let everything relax once I'm on the ground. And then I repeat. Let's go through another rep. Pelvic floor contraction, pull everything up and in. Glute contraction, rock solid butt. Lift up slowly, keeping the glutes and the pelvic floor on, and keep those muscle groups on as you march. So 1, don't let the hips drop or rotate. 2, keep breathing naturally. 3, 4, keep the glutes on, pelvic floor on as I lower down and relax everything once you get down on the ground. And this is really beneficial, again, for firing up those glutes, which not only strengthens them, but also helps to relax the hamstrings, because when your brain sees the hamstring or the glutes are working well, it can tell the hamstrings to relax a little bit. You don't have to take up the slack from the glutes that were performing poorly in the past. So this is how we get to those root causes. I call the 4th exercise the hinged knee flex. And this is a great exercise, again, for strengthening the glutes, lengthening the hamstrings, but teaching your body good patterning for when you have to do this bending over movement that we have to do in everyday life, in the gym, and sometimes in sport, depending on what sports you play. For this exercise, you start with your feet shoulder width apart or hip width apart, directly underneath your hips here. My legs are straight up and down, and feet are pointing straight ahead. From here, I bend my knees very slightly and make sure I'm in good posture with my upper body and my spine. From here, I want to get the glutes on. So contract the glutes, and we can get the pelvic floor contracted as well. And then I'm going to hinge over, keeping my spine in neutral. So chest up, chin tucked, until I feel like my hamstrings are stopping me. So my glutes are on here, my hamstrings are stopping me. Now from here, I'm going to slowly contract my quads to straighten my knee, maintaining my positioning everywhere else, and then go back to the start position. And then I'm going to contract the quads, straighten the knee, hold it for a couple seconds, and then go back to the start position. Now my glutes are on, and I'm going to use them to lift myself up, and then I'm going to relax once I'm back up. Again, let me walk you through that. Let's get pelvic floor activation, stopping the pee, pulling everything in and up, glute activation. Knees are soft, and I'm going to hinge over, sticking my butt out so I maintain this curve in my low back, the lumbar lordosis or extension. From here, I'm going to straighten one knee, fully extended, hold it for 2 seconds, keep the glutes on, and then return to normal, and then straighten the other knee, return to normal, and then use those glutes to help lift me up back to the start position. So this is going to keep those glutes fired up in this hinge movement pattern, and it's also going to do a great job at lengthening out the hamstrings, but doing it in an active way by contracting the quads here to straighten out the knee, we're telling the hamstrings to relax and loosen up. And because we have the strength here in doing that, that's going to give you better lasting results than if you're just to stretch the hamstrings out statically by reaching for your toes like that. The fifth and final exercise is called the hip hitch. And for this exercise, we need something to step on that elevates us a couple inches. So I've got a yoga block, very simple, very cheap, that you can grab. You could do it on stairs, or you could do it on maybe some wood, some exercise, some weight plates, something, anything. There's no magic to any of the equipment. You just need something to step on that elevates you. So place it on the ground, and this exercise is great because it's going to get other hip muscles, deep hip muscles activated. Now, I talked about root causes before, being lumbar disc herniation, weak glutes, hamstrings that are taut in response to weak glutes, piriformis that's taught to stabilize the hip joint because of the lumbar disc herniation. Those are all some root causes, but there's more, and others that might be there include the deep hip muscles not functioning well. So the deep hip rotators like obturators, gemellis, you don't need to know all the names of them, but just know that the piriformis can compensate for these muscles if they're not working well. And this exercise gets those other muscles working well. So for this technique, we're gonna start off with, I'm just gonna put my left foot on the ground, on the block here, so you can see my foot hanging. So you can see I'm elevated here, and I'm near a wall because you don't need to turn this into a balance exercise. You can use a wall to support yourself so you don't fall over. I'm gonna put my hands on my hips here so that you can see the level change of my pelvis. Now, the leg that is on the elevated surface, the yoga block here, stays straight the whole time. And all I'm gonna do is reach my heel down to the ground by letting my pelvis drop. And you can see this hand, my right hand, is now lower than my left hand. I'm gonna lightly touch the ground if I can. If I can't, doesn't matter. Go as far as you can. And then lift it up so that the pelvis is straight again or neutral. So I'm gonna drop down slowly. If you touch the ground, do it. So I can just lightly touch the ground. And then I'm going to use these deep hip muscles to straighten the pelvis up and hold this position for a couple seconds at the top, this level position. One more time, I'm just gonna drop down. You can see my right hand going down lower than my left, touching the ground. My knee is straight the whole time, and then I'm coming up to straight and holding that for a couple seconds. Again, this is a technique that even if I have problems on one side only, I'm gonna do this exercise on both sides to maintain balance throughout the hips and the pelvis. And like I said, this is going to help with the deep hip muscles that contribute to maintaining good pelvic alignment and balance when you're on one foot. And it contributes to strengthening those other muscles that perform a similar function to the piriformis, which is stabilizing you whenever you're on one leg. To summarize the 5 exercises we went through today, we started off with active self-myofascial release of the posterior hip. You do 3 reps of 2 different moves in 3 different areas of the hip. Next, we did the Piriformis ERE technique. Do 2 to 3 reps, holding each contraction. There's 3 contractions in each rep for 10 seconds. Next, we did the marching hip bridge. For this, you can do 2 sets of 4 reps. The 4th exercise is the hinged knee flex. Do 2 sets of 4 reps, holding those knee straightening contractions for 2 seconds each. And we finished off with the hip hitch. Do 2 sets of 5 reps per side. And you can repeat this routine 3 days a week. And after 2 weeks, you should feel some differences, but keep going for at least 4 weeks and up to 6 weeks. So there you have the precision movement approach to getting to the root causes of piriformis syndrome and SI joint dysfunction. I hope this has been helpful for you. I hope it's been educational and enlightening. And most importantly, I hope it helps you move freely and without pain. If it does, if you find this approach useful, feel free to share it with your friends, anybody who's suffering from a pain in the butt. And I've also got some other resources for you, a couple of videos of related topics here and here. And most importantly, download our ROM Coach app. And you can get that clicking on the link right here. You can download the app. There's a lot of free features in there that are helpful for you, like the daily movement tune-up, like the painkillers for acute pain, and programs that will get to all of the different root causes of problems like this. And the program for you would be the Hip Pain Solution Program. So thank you for being here with me and watching. See you next time. Peace.